I'm gonna not enter the room, provide for privacy, explain procedure, perform hand hygiene, introduce myself, and identify my patient using 2 identifiers. I'm gonna go ahead and assess my patient's level of consciousness, and so I'm gonna ask them their name, what time or what day of the week it is, and where they are. I'm also going to assess their short-term and long-term recall, so I'm gonna ask if they know why they're here and who the president is. And then I'm also going to go ahead and evaluate the symmetry of their face and all of their extremities. And I'm going to evaluate their understanding of verbal and written speech. So I'm going to start with my assessment. I'm going to go ahead and do my Glasgow Coma scale. So I'm assessing their eye opening, their verbal response and motor response. And then I'm going to would use a pen light, and I'm going to assess their pupils. So I'm gonna have them look in my eyes, and I would look in their eyes with my light, and I'm assessing if their pupils are equal, round, and reactive to light. And then I'm also going to assess their the six cardinal movements of the eyes. So I would have them follow my pen with just their eyes and not their head. So I'm gonna go from side to side, and then up and down. Okay, and then once I do that, I'm going to go ahead and feel their face on both sides, and I'm gonna ask them if that feels the same to them and if they can feel that. I would palpate their jaw, ask them if that feels the same on both sides to them. I would assess their, I would have them stick their tongue to each side of their cheek and make sure they can do that. I would also assess their smell, and I would perform a whisper test to assess their hearing. I'm going to have them smile, frown, wrinkle their eyebrows, and puff their cheeks out. And then I'm going to have them turn their head laterally, so back to the side, and then I'm gonna have them extend their head and flex it up and down. And I would ask them to shrug their shoulders. I'm gonna put my hands here and see if they can move against the resistance of my hands. And then I would have them lift both arms out to the sides on both sides, and I'm gonna have them hold them up for 10 seconds. I'm just assessing if they would drop or not. I'm also going to ask them to push against my hand on both sides. And I'm going to go ahead and assess the pulses while I'm here, and I'm looking on both sides, and I'm looking for the rate, the rhythm, the quality, and amplitude. And I would have them flip their hands over rapidly to make sure they can do that. And then also I'm going to assess hand grip in both arms. And then I move down, and first I'm just gonna go ahead and assess for any edema in the legs, and I'm gonna go ahead and check their pulses and their legs as well. And then I'm gonna have them abduct and adduct each leg. And then I'm gonna feel their legs and make sure they can feel me on both sides and that it feels the same. And then I would have them dorsiflex and flex their feet, and have them push against my hand for resistance. And then also I would assess their gag reflex and swallowing. And then I would have them stand up, and I'm going to perform the Romberg test. So I would have them stand, and I would hold out my arms in front of them for safety, and I would have them put their arms and feet together and have them close their eyes for 20 seconds, and I'm assessing if they have any swaying or wobbling. And I would also have them walk and assess their gait. And then I would make sure they're comfortable, have their call light, and they don't need anything, they don't have any complaints, and I would record my assessment and report.